Today, the word doctors often sparks distrust or doubt. But what if we could rewind history and meet the real heroes? Three extraordinary doctors who fought against injustice, disease, and neglect to save millions of lives, often without any recognition. This is their untold story, one of courage, persistence, and groundbreaking change that still saves lives today. Little Susan, imagine America, the land of the Statue of Liberty, Mount Rushmore, and the Lincoln Memorial. But long ago, this so called land of democracy denied the very rights it promised. Native Americans, the original inhabitants, were forced off their lands and pushed west beyond Mississippi River. To keep them away, the government passed the Indian Removal Act. This is where Susan's story begins. She was born on Omaha Reservation, not a town, but an exile. Why call them Indians? In 1992, Columbus set out from Spain thinking he had reached India. Instead, he landed in America and called the native people Indians. In 1607, British settlers arrived in Jamestown. The Native Americans were pushed farther west as the settlers claimed that land. Back then, doctors were all white. If Native Americans became ill, white doctors refused to attend. Many died untreated. Susan saw this suffering and made a bold decision to become a doctor herself. It was not easy. Native Americans were barred from colleges and fundings were almost impossible to get. Thankfully, social scientist Alex Cunningham Fletcher, who was doing research there, helped Susan secure a loan. Susan enrolled in the Hampton Institute at Women's Medical College of Pennsylvania. It is worth noting that India's first female doctor, Anandi Gopal Joshi, had studied at the same college just 3 years before her. In 1889, Susan La Flesche Picotte graduated and topped her medical class. She became the first Native American doctor in history. Returning home, Susan served as the only doctor in covering 400 square miles on Omaha Reservation in Nebraska. She fought tirelessly against malnutrition, neglect, addiction, and tuberculosis. She could not get government support for healthcare for decades. So in 1913, with help from local community, she established the first private hospital for Native Americans. This hospital served Native Americans for nearly 3 decades. From a humble childhood in exile, Susan showed the world how courage and determination can bring help to those forgotten by society. Duncan's Drain. Once known as the dirtiest city in the world, Liverpool was bursting at the seams as a busy port. Its population grew so rapidly that thousands fell ill at young age. Rumors spread that Liverpool had the highest death rate in England during that time. Typhus, typhoid, and diarrhea swept through the crowded streets like deadly storms. At this critical moment, a local man from Liverpool, Dr. William Henry Duncan, returned home after studying medicine in Scotland. In 1830, no one understood what caused diseases. When someone died, it was often blamed on their own sins. Duncan has a passion for looking at maps. As he studied Liverpool city's map, he noticed a striking pattern. The most densely populated neighborhoods were also the places where deaths were highest. At first, people ignored Duncan's warnings. However, he persisted, giving lecture after lecture and disturbing leaflets. His message was sharp and clear. Wake up, look around. Filth, rotten houses, and rubbish everywhere are killing people. Gradually, his voice was heard. In 1846, Liverpool Town Council passed the Liverpool Sanitary Act. Officials told Duncan, "If you are going to shout so much, then you shall be our medical officer." By a combination of faith and effort, Dr. Duncan became the world's first medical officer of health. He worked closely with Thomas Fresh, the sanitary inspector, and James Newlands, a civil engineer specializing in building houses and water systems. Together, they constructed 140 miles of drains beneath the city. For that time, this was revolutionary. When Joseph Bazalgette began digging drains in London, he was 20 years behind Liverpool. Liverpool, one believes, its high death rate was the punishment for sin. Thanks to Duncan, people began to think differently. They realized that disease spread because of filthy conditions. In recognition of Duncan's remarkable achievement, England created a large public health department, which continues to promote health awareness even today. Thanks to him, the world learned that building a city is not enough. Proper sewage system and rubbish removal are essential, and the government must ensure that people follow the rules. The mute modest Mahalanobis. Even today, over 500,000 people worldwide die each year from diarrhea. Data shows that for children under 5, diarrhea-related illness remains the leading cause of death. Science tells us that most cases of diarrhea resolve on their own. So, why do people still die unnecessarily? The answer is simple: a lack of water and the correct balance of salts in the body. Does giving water with salt to a patient save a life? Yes, but as salt alone doesn't enter in the body as good. In parts of India, the simple life-saving remedy is known as sharbat. Yet, despite its simplicity and effectiveness, we often resist these humble solutions. One of the pioneers in researching how salt and sugar water can save lives was Dr. Dilip Mahalanobis, who lived in Salt Lake, Kolkata. Born in 1934 in present-day Kishoreganj, Bangladesh, this modest hero saved countless lives without keeping count. During the 1971 Bangladesh War, he traveled from camp to camp, giving children oral rehydration solution or ORS, saving thousands. When used correctly, ORS reduces the risk of death from diarrhea by approximately 90%. It is worth considering whether any other medicine in the world is this effective. Without hospitals, intravenous fluids, antibiotics, or expensive drugs, ORS continues to save lives globally even today. There is debate about who truly invented ORS. Long before Mahalanobis in 1952, another Bengali scientist, Hemendranath Chatterjee, first mentioned a similar solution in the Lancet journal. However, Western experts ignored his works entirely. Mixing salt and sugar water in random amounts will not work. The precise proportions are crucial. Under the hot sun, Mahalanobis and his team went door to door, distributing correctly mixed ORS. Today, many professors and researchers hold multiple patents and actively engage in office politics to secure them. Meanwhile, Mahalanobis never patented his ORS formula, choosing instead to benefit the ORS poor. Dr. Agnimitra Giri Sarkar, Aparkar of Kolkata's Institute of Child Health, told the Lancet Infectious Disease Journal few days back that Mahalanobis' ORS saved the lives of about 55 million people. Most of them were children. Yet, during his lifetime, India did not honor him with Bharat Ratna, Padma Vibhushan or Padma Bhushan. Shy by nature, Mahalanobis remained distant from networking and lobbying among the powerful. Finally, in January 2023, he was awarded the Padma Vibhushan long after this humble hero had passed away. Another Indian name must not be forgotten, Dr. Dhiman Barua. While Mahalanobis fought cholera from Afghanistan to Egypt and Bangladesh to Pakistan, Barua headed the bacterial disease unit at World Health Organization. Inspired by Mahalanobis' work saving children's lives, Barua helped secure ORS's place as a key diarrhea control tool for WHO and UNICEF. Once cholera, typhoid, plagues, and wars claimed millions of lives. We never imagined escaping those scourges. Today, cancer is the global epidemic. Those suffering might find it hard to believe, but one day we may as well be free of cancer too. I remain hopeful that day will come soon. Take care. See you soon. Please do comment below. I'll try to answer. See you over another video research article very soon.